Hey everyone, and welcome to Health After 50 Compass. Today, we're diving into a topic that can be pretty scary: chest pain. It's something that millions of people experience, and knowing the difference between harmless discomfort and a real emergency is so important. In this video, we'll cover it all: the common causes of chest pain, the warning signs you should never ignore, what to do in those first few moments, and how to keep your heart healthy with a balanced diet. Whether you felt chest pain before or you're just worried about your heart, you're in the right place. Let's get started. Chest pain isn't always a heart attack. It can come from different places within your chest. Think of your chest like a busy city. Your heart is there, but so are your lungs, esophagus, muscles, and bones. Pain is like a traffic jam. It can happen anywhere in the city, not just on the main highway. We'll explore the different neighborhoods in your chest and what can cause trouble there. The heart is like the engine of your body. When it hurts, it's a big deal. Angina, for example, is like the engine sputtering. It's chest pain from reduced blood flow to the heart muscle. A heart attack is like the engine seizing up. Blood flow is completely blocked, causing severe pain. And pericarditis, inflammation around the heart, is like having a grinding noise in the engine compartment. It's a sharp pain that worsens with breathing. Now let's move beyond the heart to other parts of our chest city. Your lungs are like the bellows, essential for breathing. Problems like pulmonary embolism, a blood clot, or pleurisy, inflammation, can cause sudden, sharp chest pain. Your esophagus, the food pipe, can also be a troublemaker. Acid reflux or muscle spasms can mimic heart attack pain. Even muscle strain or problems with your ribs can cause chest pain. Remember, it's a complex neighborhood. Let's start with the big one: your heart. When your heart hurts, it's sending a message that shouldn't be ignored. One of the most common cardiac causes of chest pain is angina. Imagine your heart as a house that needs a constant supply of electricity. Angina is like a brownout. The lights flicker because the house isn't getting enough power. This happens when the blood flow to your heart muscle is reduced, often due to narrowed arteries. You might feel pressure, squeezing, or a tightness in your chest, often during physical activity or emotional stress. It's your heart's way of saying, "Hey, I need more blood flow here." Now imagine a full-blown power outage. That's a heart attack. This is a medical emergency where blood flow to a part of the heart is completely cut off, usually by a blood clot. The pain is often much more intense and crushing, and unlike angina, it doesn't usually go away with rest. We'll talk more about what to do in those situations a little later. Now, let's move on to our lungs, those vital bellows that keep us breathing. When something goes wrong with our respiratory system, chest pain can be a red flag. One serious culprit is a pulmonary embolism, or PE for short. Imagine a traffic jam in your lungs. That's essentially what a PE is. It happens when a blood clot, often from the legs, travels to the lungs and blocks an artery. This blockage can cause sudden, sharp chest pain that often worsens with deep breaths. Another lung-related issue is pleurisy, which is inflammation of the lining of the lungs. This can feel like a sharp, stabbing pain, especially when you breathe in or out. It's like having a tiny cactus poking you from the inside every time your lungs expand. Even something as common as pneumonia, an infection of the lungs, can sometimes cause chest pain, along with coughing, fever, and difficulty breathing. So, if you're experiencing any kind of chest discomfort and breathing feels labored, it's crucial to get it checked out. You might be surprised to learn that sometimes what feels like heart trouble is actually a problem brewing in your gut. Our digestive system can be a bit of a drama queen, and when it's unhappy, it can definitely let us know with chest pain. One of the most common culprits is acid reflux, or GERD. You know that burning sensation in your chest and throat after a spicy meal? That's acid reflux, and it happens when stomach acid flows back up into the esophagus. While it's usually harmless, frequent or severe acid reflux can be a sign of something more serious. Then we have esophageal spasms, which are like Charlie horses of the esophagus. These muscle contractions can cause intense chest pain that mimics a heart attack, leading to a lot of unnecessary worry. Even gallstones, those pesky little stones that form in the gallbladder, can sometimes cause chest pain, even though the gallbladder is located in the abdomen. It's like your body's own game of guess where the pain is coming from. Now, let's explore some other potential causes of chest pain that you might not expect. Believe it or not, sometimes those aches and pains are coming from your muscles and bones, not your internal organs. Remember those chest muscles we talked about? Well, just like any other muscle in your body, they can get strained or pulled, especially after a tough workout or heavy lifting. This type of chest pain is usually sharp and localized, and it tends to worsen with movement. Another common culprit is costochondritis, which is inflammation of the cartilage that connects your ribs to your breastbone. This can cause a sharp, stabbing pain that feels like it's coming from deep within your chest. It's often worse when you take a deep breath, cough, or sneeze. And then we have anxiety. Yes, you read that right. Anxiety can actually manifest as physical chest pain. When we're stressed or anxious, our bodies go into fight or flight mode, which can cause a whole cascade of physical symptoms, including chest tightness, rapid heartbeat, and difficulty breathing. Now, let's talk about the serious stuff, the warning signs that should never be ignored. A heart attack is a life-threatening emergency, and knowing the red flags could save your life or someone else's. The classic heart attack symptom is severe, crushing chest pain, often described as a heavy weight or a tight band squeezing your chest. It's not usually a fleeting pain. It tends to linger and can even spread to other areas. And speaking of spreading, heart attack pain can radiate to the left arm, jaw, back, or even the upper abdomen. It's like your heart is sending out an SOS signal through your nerves. Along with chest pain, other warning signs include shortness of breath, even when resting, breaking out in a cold sweat, nausea or vomiting, and feeling dizzy or lightheaded. While chest pain is often associated with the heart, remember those other neighborhoods in your chest? They have their own set of warning signs too. If you experience sudden sharp chest pain, especially with shortness of breath, it could be a pulmonary embolism, that blood clot in the lungs we talked about. This is a serious condition that requires immediate medical attention. Sharp, stabbing chest pain that worsens with breathing could be pleurisy, that inflammation of the lining of the lungs. And if you have chest pain, accompanied by a burning sensation in your chest or throat, especially after eating, it could be severe acid reflux or GERD. Remember, chest pain is always something to take seriously, even if it turns out to be something less serious than a heart attack. Section 3. Trust your gut. When in doubt, check it out. Here's the bottom line. If you're ever unsure about chest pain, don't hesitate to seek medical attention. It's always better to err on the side of caution. Your doctor can perform tests like an electrocardiogram or ECG to check your heart rhythm and blood tests to look for signs of a heart attack. They can also order imaging tests like a chest X-ray or CT scan to get a better look at your heart and lungs. Remember, early detection and treatment are crucial for preventing serious complications. So, listen to your body, trust your gut, and don't hesitate to seek medical help if you have any concerns about chest pain. In the next section, we'll discuss what to do if you or someone you're with experiences severe chest pain. Stay tuned. Section 1. Recognizing the emergency. Every second counts. We've talked about the warning signs, but what do you do if you think you or someone around you is having a heart attack? First, don't panic. Easier said than done, right? But staying calm helps you think clearly and act fast. Recognize that this is an emergency. Severe chest pain, especially with those other red flags we discussed, pain radiating to the arm, jaw, or back, shortness of breath, sweating, nausea. Those are signs to call for help immediately. Don't try to tough it out. Don't wait to see if it gets better. Every second counts when it comes to heart attacks. Immediate action is crucial. Section 2. First aid steps. Taking action while waiting for help. So you've recognized the emergency. What do you do while you're waiting for the paramedics to arrive? The first and most important step is to call 911 or your local emergency number immediately. Tell them you suspect a heart attack and give them your exact location. Once you've made that call, help the person experiencing chest pain sit or lie down in a comfortable position. Loosen any tight clothing that might restrict their breathing. If they have any prescribed medication for chest pain, such as nitroglycerin, help them take it as directed. If they're conscious and able to chew, offer them a regular dose aspirin. Aspirin can help thin the blood and potentially limit damage to the heart. We've talked about recognizing the warning signs of chest pain and taking action in an emergency. But what about preventing those problems in the first place? One of the most powerful tools you have is your fork. The food you eat plays a huge role in your heart health. Imagine your heart is like a car. You wouldn't put sugary drinks and greasy fast food in the gas tank, would you? Just like a car needs the right fuel to run smoothly, your heart needs a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. Think of it as filling your plate with a rainbow of colors. Cut back on processed foods, sugary drinks, and unhealthy fats. Those are like sludge in your heart's engine. Instead, focus on whole, unprocessed foods as much as possible. Now, a healthy diet is a great start, but it's not the whole picture. Think about it. Even a well-fueled car needs regular maintenance and a good driver to stay in tip-top shape. For your heart, that means regular exercise. Aim for at least 30 minutes of moderate intensity exercise most days of the week. And just as important as moving your body is managing stress. Chronic stress is like riding the brakes in your car. It wears down the engine over time. Find healthy ways to manage stress, whether it's through meditation, yoga, spending time in nature, or connecting with loved ones. Remember, taking care of your heart health is a lifelong journey, and you don't have to go it alone. Think of your doctor as your co-pilot on this journey. They can help assess your individual risk factors, recommend personalized lifestyle changes, and prescribe medications if needed. Don't be afraid to ask questions, share any concerns you have, and work together to create a plan that supports your heart health for years to come. Remember, knowledge is power, and taking proactive steps to maintain a healthy heart is one of the best gifts you can give yourself and your loved ones. We've covered a lot of ground today, from the different parts of your chest to the many things that can cause chest pain. Remember, your heart is at the center of it all, working tirelessly to keep you going. Chest pain is your body's way of saying, "Hey, pay attention. Something might be up." It's a signal that should never be ignored, especially if it's severe or comes with those other warning signs we talked about. But here's the good news. By understanding the causes of chest pain, recognizing those red flags, and taking proactive steps to keep your heart healthy, you can significantly reduce your risk of serious problems down the road. Think of it like this. You wouldn't ignore a strange noise coming from your car engine, would you? You'd take it to a mechanic and get it checked out. Your heart deserves the same care and attention. I hope this video has empowered you to take control of your heart health. Knowledge is power, and the more you know about your body, the better equipped you are to make healthy choices. If you found this video helpful, please give it a thumbs up and share it with your friends and family. You never know who might benefit from this information. And don't forget to subscribe to Health After 50 Compass for more informative videos on staying healthy and feeling your best in your prime years. Hit that notification bell so you don't miss any upcoming videos. Remember, your health is your most valuable asset. Take care of it, stay informed, and I'll see you in the next video.